We need the legislature, we need the governor especially, we need the federal administration, and we need the California voters. So what is it going to take to win that political majority against the $200 million or whatever it is that the insurance industry will spend against us?
911, what's your emergency?
America's healthcare system is broken and people are dying.
Welcome to Code WACK, where we shine a light on America's callous healthcare system, how it hurts us, and what we can do about it. I'm your host, Brenda Gazar. This time on Code WACK. As attacks on public health care ramp up, what's California doing to fight back? Can the state break free from a system that puts profits over patients and build a truly universal single-payer healthcare system? Or will political roadblocks and federal inaction keep us stuck in a broken status quo? To find out, we spoke with Michael Lighty, president of Healthy California Now, who's organized, advocated, and developed policy for single-payer Medicare for all nationally and in California for over 3 decades. He's a founding fellow of the Sanders Institute, and he was healthcare constituency director for the Bernie 2020 campaign. Most recently, he co-wrote and was leader in the successful campaign to enact California's Senate Bill 770, a critical step toward negotiating the federal waivers the Golden State needs to build a universal, publicly financed healthcare system. Welcome back to Code WACK, Michael.
Thank you, Brenda. As always, great to be here.
So great to have you. You've worked on many healthcare reform campaigns in California, most recently on Senate Bill 770, which won and was signed by Governor Gavin Newsom in October 2023. That bill lays the groundwork for California to start talking to the federal government about getting waivers needed for universal health care in our state. Let's touch on why waivers are important for a state-based single-payer system. It's all about capturing federal dollars, right?
Yes, that's right. And the reason that's important is because there are so many federal dollars. And, depending on different estimates, it can, and you include Medicaid or Medi-Cal in our case, and Medicare, as well as the Children's Health Insurance Program, the subsidies under the Affordable Care Act, not to mention the Veterans Administration, TRICARE, which is the military health insurance program, and the Indian Health Service, as well as the monies that go directly to federally qualified health centers. It ends up to be maybe as much as half of the total spending. Now, when we try to merge federal funds into a state single-payer system, we exclude some of those, like TRICARE, Veterans Administration, Indian Health Service are not part of it. But as much of those other monies that we can capture, we need to in order to then lower the amount that we have to pay for through California revenue sources. So yeah, it's essential. And you can't really incorporate those federal monies without permission from the federal government in the form of a waiver. How you can integrate Medicare is an ongoing policy question, but there are waiver procedures under the Social Security Act for Medicaid, Medi-Cal, and under the Affordable Care Act. So those waiver provisions are available to us, and that's what we want to talk to the federal government about. The federal government doesn't want to talk to us. So here we are.
So you mentioned Medicaid and the Affordable Care Act waivers. Are there any other critical waivers that would be required for California or any state enacting single-payer legislation to maintain the federal funding they're currently getting?
You want to do, and what a federal administration would be willing to do with Medicare funding, you would have those discussions. There's not a formal waiver procedure under the Social Security Act for Medicare. The only state that got a version of that is Maryland, and that took legislation. There are no waiver provisions, for example, for ERISA, which is the Employee Retirement and Income Security Act, I think. And ERISA is not subject to any existing waiver authority. So there are certain parameters and things to be negotiated with the federal government beyond the explicit waiver authority if states were to choose to do that.
So it's the federal government that approves lots of waivers, and we know that waivers for single payer are possible, but it doesn't seem like this is the time with the current administration. So how does that affect what you guys are doing right now?
SB 770 was, of course, as you say, geared toward preparing California to engage with discussions with the federal government over these waivers. The other part of it, though, was to also come up with strategies and programs that could move California toward universal health care and would explore what California can do on its own. So that part of 770 remains live, and that's what we're working on. What are the elements of the current system that California can build on in order to achieve the objectives of creating a single-payer unified financing system, and what can we do in the meantime without federal engagement? And that was an explicit part of 770. What can California do on its own? It came out of the Healthy California for All Commission report, said the same thing. Let's explore what California can do on its own. So that's really what we want to do. We want to get the system design policy paper from the UCLA Center for Health Policy Research, which has been completed but not released. We want to review that report. We want to organize community engagement around it. We want to utilize that, depending on what those recommendations are, or the recommendations we think are most favorable, to use that as a roadmap to figure out what California can do on its own, and to obviously prepare for what we hope will be the next administration in 2029. And California's a big state. I guess the fourth largest economy in the world currently. So you would think there's a lot that California can do. And ultimately, we'll need to engage with the next governor, who will be elected in 2026 and be in charge as governor during 2027 and 2028 as that work continues. And so that's the other task, is to lay the groundwork for engaging with the next California administration.
SB 770 required that the California Health and Human Services engage stakeholders in the planning process. So has this started, or are we waiting for the UCLA report to come out first?
We're waiting for the UCLA report. And because of the LA fires and the federal threats and cuts and changes to Medicaid and health policy in general, that department that oversees this work and will oversee the stakeholder engagement has their hands full. And so that report from UCLA hasn't been released. We're hoping that we get through the budget and they'll have some capacity, release it, and begin that stakeholder engagement process. In Healthy California Now, we'll organize a community engagement program as well once the report's released.
Beautiful. And what are you hoping will happen with community engagement in this process?
We want to use that to evaluate the different policy proposals that will be in the report, because they're not going to make just one recommendation, presumably. Evaluate different policy approaches, understand what really hasn't happened. We haven't just engaged in listening to folks whose experience with the present healthcare system may vary quite a bit based on where they live, their health condition, the type of insurance they have. The Healthy California for All Commission did a survey of low-income Californians making 250% of federal poverty or less. Very good information gathered from that, but we need to expand that. And we need to really try to listen to folks about what their experience is and what kind of health system they want. And that, I think, is a process that could be very instructive for the next governor here. And as we prepare for a system design proposal the legislature would consider as the basis for engaging with the federal government for those waivers. And that was a process that was supposed to happen this year. We had a couple of report deadlines, one around this time and one in November, which are not being done because there's no engagement with the feds. So you can't have a report about discussions that are not happening. So those presumably will be able to restart that process. And that process starts once the legislature considers the first report from the Department of Healthcare Services about their policy priorities. That report was also not submitted. And so at the point in time in which it is, the legislature will consider it, and they will consider the waiver authorization at that point, and not making a final decision, of course. And so to inform that process, which is probably a couple of years away, we think there can be a lot of community engagement and real discussion and listening to Californians about what kind of healthcare system they want.
So have there been any discussions regarding the waivers at all with federal officials?
My understanding is that there have been no discussions between California officials and federal officials about the waivers.
So despite the unfavorable political climate, Senator Bernie Sanders and Congresswoman Pramila Jayapal introduced updated Medicare for All bills this year. Who else is showing support for single payer in Congress, especially at the state-based single payer level?
Obviously, Congressman Ro Khanna has introduced his bill for what they call state-based universal health care. Senator Merkley from Oregon is doing a counterpart in the Senate. So there is that effort legislatively. I think the federal effort to keep the issue prominent and keep the national demand for Medicare for all is very important. Improved Medicare for all, as we say. But we've got to have an alternative to what the current federal administration's doing. And that alternative is not taking 8 to 13 million people off of health care and basically killing some number of people because they don't have health care. It's just absolutely tragic and horrific. The alternative to that is to guarantee health care for everybody and improve Medicare for all. So that's got to be our objective. It's got to be out there. And it's got to be clear that we want to go in the opposite direction from where it's currently going. So it's very worthwhile. We have to proceed ultimately with whatever federal legal framework we have, right, for waivers. Be great if we could get more flexibility, which the Khanna bill provides. But even absent that, we still have the opportunity to set up a kind of system that can guarantee health care for all Californians. So either way, we will pursue it. And a more favorable federal environment in Congress is only helpful.
So California's Gavin Newsom ran for governor on a platform that included single payer. If he runs for president in 2028, could his campaign affect his stance on single payer and what happens with SB 770?
Let me consult my crystal ball and I'll let you know. I don't think it's going to affect his stance on SB 770. SB 770 is very similar to what's going on in other states, particularly Washington and Oregon. So there's nothing particularly controversial about it in a democratic context. And in fact, it's a very smart and strategic approach to figure out how you're going to guarantee health care for everybody. I suspect that the governor will want to run on universal coverage and make the case that California has achieved something that's very impressive, that we've covered whatever it is, 98%. If he rolls back the undocumented programs, it will be less. And so it depends on how he views the politics of that issue. But in terms of his stance toward a federal program or characterizing California's progress, but the truth is that coverage is not care. And so universal coverage is, under the present system, better than not by quite a bit, saves lives. But it is not the same as guaranteeing health care to everybody.
Was there anything else you wanted to say about SB 770?
SB 770, as I said, is a smart and strategic approach because we had the political coalition sufficient to win it. And that can't be said about any other approach to single payer. And we brought in those healthcare reform advocates who are working on immediate reforms, who have a great currency and a very important constituency with longtime single payer activists to build that coalition, bring in a higher level of union support, and enact it. That's a huge achievement. And it's also exactly what Oregon and Washington have done. So the question is, should we do more? Well, we should always make sure that legislators and the governor know we demand single payer because we want to keep that demand alive because that furthers this process. If we expect that the legislature is going to establish a full-blown program, it's just going to happen overnight, that's not a realistic expectation, and we don't have the political support at this point to win that. That's why I really think that we're on the right track politically. We have the moral imperative behind us. We clearly have popular opinion. We have a persuasive policy case, proof that it saves money, but we haven't built the political strategy and the political coalition to win until we did 770. And so I think we have to take the politics of this very seriously because we need a majority of California voters, which is what is ultimately required. We need the legislature, we need the governor especially, we need the federal administration, and we need the California voters. So what is it going to take to win that political majority against the 200 million or whatever it is that the insurance industry will spend against us? And taking that question seriously is what I think single payer advocates ought to be devoted to. So when we talk about a process of community engagement, we're talking about a process of listening and inoculation, so that we have a dialogue that sets people up to not fall for the lies of the industry when they see them on TV during the ballot campaign.
Thank you, Michael Lighty of Healthy California Now. If you love Code WACK, keep us on the air with a tax-deductible donation at heal-ca.org/donate.
Do you have a personal story you'd like to share about our WACK healthcare system? Contact us through our website at heal-ca.org. And don't forget to subscribe to Code WACK wherever you find your podcasts. You can also find us on progressivevoices.com and on Nurse Talk Media. Code WACK's powered by Heal California, uplifting the voices of those fighting for healthcare reform around the country. I'm Brenda Gazar.